I'm going to call this my Saturday suggestions. This is specifically for professionals. You can be in medicine, law, any other industry, but there's certain things I call in the rules of medicine that can apply in other things. Rule 23. CYA. Cover your ass. It's about documenting. And since this may be a little series, let me start with number 1. No matter what institution you're at, you should always CC yourself an email that comes from a higher position, power, HR, whatever that may be. CC that email to your private email. So therefore, if ever the institution decides to lock you out of that email, you always have access to it. Case in point, we had a resident that was going to be fired, and that resident had all of the emails into the institutional email address, not her private email address. Thus, when they decided to start to dismiss her, they locked her out, and she had no proof that there was any type of communication. Number 2, which probably should have preceded number 1, would basically be in documenting everything. These are little things, everything from what you feel, what you think, and or what you know. If you believe someone has slighted you or harassed you or bullied you or made you feel some type of way, and or you think that there is a certain person that may have called you incompetent or, a bad situation that went down, CYA. Document it, email it to yourself and maybe your mentor or your advisor, just as an FYI, and therefore you create a timeline to be strategic if anything ever does happen or go down. So I'm not trying to create a precedence for you to be, again, paranoid. I'm trying to create a precedence for you to be strategic and smart, and always CYA.